Good afternoon, everybody. Sorry for the technical difficulties we had getting this off the ground. I know we're starting a couple of minutes late, but we will get through all the material this afternoon. My name is Mark Adams. I'm Director of Compliance with EANE. And I'd like to welcome you to today's online event on the COVID-19 vaccinations. We decided to put on this program not so much as a webinar, though some of the content will lend itself to that today. And yes, we do have some slides to keep us all on track because of all the different issues we're going to put on the table today. But it is more of almost like a town hall for purposes of raising awareness of and getting your questions answered on the subject. And there are obviously many questions to be asked. And based on the robust attendance that we have for today's program, we would like you to hold off. We will be holding off on entertaining questions until the end. Should you have questions, and I know you do, please enter them in the Q&A feature of Zoom. Allison Ebner, who is our Director of Membership and Partnerships, will be monitoring them and putting them on the table for discussion. Okay. If I can just advance my slides, we will be good to go. But first of all, what I'd like to do today is introduce our co-presenter for today's event that we are going to cover over the next 60 minutes. And I would like to welcome Tim Murphy, who's a partner from the law firm of Skoler and Abbott. We've worked with Skoler and Abbott for decades now. And Skoler and Abbott's a law firm that specializes in working with companies from and solely representing management when it comes to labor relations and employment law matters. They specialize in management specific representation only. As you can see here, Tim represents companies on a number of different subjects. And Tim has also extensively worked with us on mass paid family and medical leave. And he, as well as the others at the firm, have worked with us on a lot of issues related to this subject as well. Tim, thank you very much for joining us this afternoon.
Well, thank you, Mark. It's good to be with you and everyone else to talk about this important and interesting topic.
All right. So this is what I want to accomplish this afternoon. First, we wanted to provide an update on the vaccination race itself that's out there trying to head off this worldwide pandemic. And then we're going to shift into some of the state distribution plans that are out there developing in Mass, Connecticut, and Rhode Island. And as you will see, they're not all one and the same exactly, but we hope to kind of go through that foundational material fairly quickly. What we want to focus on, of course, and what the majority of the program will focus on is us setting the table for you on the issues and questions that you should be thinking about now as we finish up 2020 and head into 2021 on this topic. I will then be shifting over to Tim, and Tim will be spearheading the conversation, though I will be chiming in along the way, and certainly Tim will also be chiming in on the material that I'll be covering as well. And then, of course, we want to encourage you to put your questions on the table so we can get those addressed the best way we can with the information that we have at our disposal. So much of the attention has been centered around the research and development of vaccinations in the United States. However, this has truly been a global effort. All told, there's over 40 initiatives worldwide at various phases of development taking places in countries such as England, Russia, and China, just to name a few. Typically, the development of vaccines usually is a marathon and not a sprint due to the multiple phases of development that have to take place. That entails not only smaller but larger scale trials in testing out those potential vaccinations before an agency will grant its use. Such authorizations are not internationally based, but rather are based on a country-by-country basis. Obviously, in the United States, the Food and Drug Administration is the agency that handles that in the United States. So far, 2 pharmaceutical companies have made it through the phases set forth in the United States and have sought review for approval. Pfizer, for instance, has received that approval back on December 11th, whereas Moderna is widely expected to get that approval as well, perhaps as early as later today or early next week. However, these approvals right now are granted just for emergency use authorization only and not full use. This is granted under what is called the Public Readiness and Emergency Preparedness Act, otherwise known as the PrEP Act. The significance of this is twofold. Number one is it expedites the ability of these companies to kind of go through the various stages that it would take to get something approved. And it allows the FDA to make a judgment as to whether or not it's worth releasing something for use, even if not all the evidence possible could be summoned to fully establish its effectiveness and safety. However, the second component that I wanted to put on the table is that the PrEP Act provides total immunity for pharmaceutical companies who have been granted the right to produce and distribute the product. In other words, individuals will not be able to sue them directly if they get sick or otherwise develop side effects from the use of these vaccines. And if you have a question about, well, when might the pharmaceutical companies be granted full use authorization as opposed to emergency use authorization, that is still yet to be determined. Now, neither Tim nor I are scientists or healthcare professionals, so really we are not going to get caught up in the detail of exactly how and what the vaccines are made of. But at a very high level, according to the CDC, we wanted to talk about it to some degree. And the vaccines that are getting this emergency use authorization currently are what's called RNA vaccines. RNA vaccines themselves are manufactured somewhat differently than what vaccines historically have been produced by. Typically, when you talk about something like a flu vaccine, for instance, usually they put a weakened or inactivated germ into our bodies for purposes of trying to generate an immune response. RNA vaccines don't work that way. Rather, they are a synthesized production of some genetic code that triggers the response instead. I simply say this because for employers who may say that they will get sick or get the virus from the use of an RNA-based vaccine because they are drawing on their experiences from getting a flu vaccine, for instance, it's simply not going to be the case. That's not to say that there aren't side effects, however, from all of this. CDC has reported side effects that range anywhere from fatigue to headaches to muscle and joint pain, soreness and redness in the injection spots, and that's just to name a few. One of the things to take stock of for people who are thinking about getting the vaccine is, as a condition of granting emergency use authorization, the Food and Drug Administration is requiring those who are administering the vaccine to distribute fact sheets to individuals that detail the full span of side effects and other aspects associated with the vaccine itself. Which then kind of takes us over to looking at the distribution plans that are out there in Mass, Connecticut, and Rhode Island. First of all, before the state started putting together the distribution plans, the Centers for Disease Control required states to actually produce plans and submit them to the federal government for review. In this regard, the CDC also put together a model template plan that states could consider adopting in whole or in part. The template actually is out on the CDC website itself. What I will say, however, relative to these distribution plans is they are very similar. There are some slight differences, however. I would say that the general consensus when you look at these distribution plans, and we will be kind of providing a summary overview of that, is that that basically is twofold. Number one, healthcare and emergency responders are going to be prioritized in getting the distribution of the vaccine. but also second, and that is that the mainstream general population as a whole is not going to actually see the vaccine for a while, with late spring being the earliest projection. And you can see that here in the Massachusetts plan. Like I said, targeted will be your first responders, your healthcare workers, whether it's in healthcare hospital settings or home care settings itself, all the way down to the likes of people in the early education system, as well as people, of course, who are at high risk based on conditions that they have. So in the case of Massachusetts, for instance, you can see that they really have tried to prioritize these in order, and they've been very specific, even down to phase 2 with the high risk people, where the people with 2 or more conditions are going to get priority over people who might be high risk due to only having one health condition that puts them at risk itself. Whether or not April to June timeframe for general population being given access to that, whether or not that does continue remains to be seen. And I point that out simply because here is Connecticut. It's a little more streamlined. It's not necessarily as detailed. But again, you can kind of get a sense of the same intent. And that is, let's get emergency responders and healthcare people the vaccine first, work our way through high risk people second, and then go out to the general population finally third. To that degree, I think the one thing, though, again, that's pretty insightful is Connecticut is not as optimistic as far as when they're going to have sufficient supply of the vaccine to get it in the hands of the general population. They've actually projected that they won't have it available for the general population until the summer. So again, I think you should be fully prepared to see these timelines change depending upon how distribution and production happen with the pharmacies and whether or not there are any hiccups that might be encountered with regards to that. And then that takes us over to Rhode Island's. Now, in the case of Rhode Island's, they actually, again, at least as of yesterday, had not put together their final version. If you go on to the Rhode Island's website, they actually have a draft plan in place that pretty much models the CDC template that I alluded to earlier, which does break out, again, more specifically, the order of people that will be eligible to receive the vaccine and in what order. However, the one thing I do want to point out here is that the state of Rhode Island, unlike Mass and Connecticut, have not put together a timeline insofar as when the general population could expect to receive it. But again, our assessments would be hopefully summer consistent with Connecticut. Whether or not they would fall in line with Massachusetts for the springtime, that is more of an open question there. So I just wanted to do a very quick rundown as far as the distribution plans themselves and the timelines that we should expect. And while those timelines are still out there in the distance, months out for some, although we do have some companies on the line that might work in the healthcare sector, the human service sector. You might be dealing with these questions right now because you might have workers that are in the process of being able to access it sooner. But even for those companies that are manufacturers, finance, or other industries that don't have priority workers involved with it, make no mistake, those months are going to go very quickly. And with that, we wanted to make sure you became fully aware of some of the questions that you should be considering. So what I'm going to do now is I'm going to turn it over to Tim to start facilitating and introducing the questions and issues that you should start to be thinking about right now. Tim, take it away.
Thank you, Mark. Good afternoon, everybody. Let us begin in this employer issues section with what is maybe the question most on folks' minds. And that is, can employers mandate that the vaccine be taken by employees? The short answer to that question appears to be yes, employers can. The More complicated and perhaps more important question is whether employers should, which I think we'll be weighing in on, both Mark and I, before we wrap up today. But employers, there is no definitive legal pronouncement of any kind that employers may not mandate the COVID-19 vaccine for employees. So there's no word that it can't be done. There's certainly precedent in the past, whether it's the swine flu or the influenza, that authorize employers under certain conditions to do so. So it does appear that employers may, even though there is some uncertainty over the fact that the Pfizer vaccine and maybe soon Moderna vaccines are only going to be available through, as Mark indicated, the emergency use authorization. And so that is a little less certain a status than full FDA licensure, a process that takes many more months to play out before there is a complete green light here. But aside from that uncertainty, in my view, employers may do so. There are certain conditions and exceptions which to that general statement, and those relate to both disability related situations, possible religious exemptions, and for unionized employers, a question about whether they can just go ahead and do so without consultation, input, and possibly approval by the unions that represent their workers. But as a general statement, the answer is yes, you can. Although the advice that I have for you is that you should not do so, certainly for now. And that is based on a number of considerations that I will be speaking to shortly, and I'm sure Mark will as well. And those range from the fact that there is no reason to believe right now that any of the governors of the Massachusetts states, New England states, will be requiring the vaccine for citizens and residents. Public health experts are also not supportive of mandates at this point. On the federal level, President-elect Biden has signaled that he and presumably his administration is not looking at vaccine mandates right now. There's also no reason to think that the federal OSHA, Occupational Safety and Health Administration, is going to impose any vaccine mandates on employers. So whether it's from a purely public health or public policy point of view, vaccine mandates did not seem imminent by any means right now. Also, employers considering a mandate, aside from what other experts are saying, should be mindful to avoid any backlash at this point that might come from employees and employee morale issues related to a vaccine mandate. As I'm sure you've all been paying attention to, there is a significant segment of the American population that has some real vaccine hesitation, whether that be generally speaking, or there is a certain, I guess, lack of confidence over a COVID vaccine, which may really be quite rational given the speed at which it is essentially come to market and potential distrust that employees may have around that, just over the safety, given the rapidity in which it's come forward. So for some of these reasons, including potential liability reasons, given the newness of the vaccine employers may want to adopt a wait and see approach to requiring a vaccine. And another practical reason why that may make sense is because, as Mark indicated, based on distribution plans, for most folks, vaccines won't even be available for many more months. So these are something that you should weigh if you're considering vaccine mandates, that this may not be the time to do it, and doing so might be a bit hasty. But I just want you to go back to the prior slide, because I've kind of jumped around a bit. And the question really is, we've answered can the vaccine be required? And the answer is yes, although for myself, I don't think that's the thing to do right now. The next question is, can it be mandated for employees in certain jobs? And of course, the answer to that is yes. And it really, if you are seriously considering the mandate at this point, and I'm assuming we're really talking about non-healthcare, non-congregate care employers, is if you are considering it and are moving towards a mandate, it may make a lot of sense to look hard at the employees in your workforce and make more narrow determinations that there's a more compelling need for some of those folks to be mandated to be vaccinated than others. So being selective about which employees are mandated to take the vaccine may well make a lot of sense, and may therefore reduce, whether that be employee morale or potential liability related issues to the vaccine, where you have made a determination that the need for vaccination is greater for some of your employees rather than all. And are there exceptions to the mandates? Yes, there are exceptions, which largely revolve around our anti-discrimination laws, namely Title VII and the Americans with Disabilities Act. Exceptions, so under both federal law, and many states then have their own state laws that mirror the Title VII and ADA. And so those exceptions really relate to situations, let's take disability first, where a worker cannot be vaccinated due to disability related reasons. The employer then is required to consider whether there are any reasonable accommodations, generally speaking, that can be agreed upon or put in place anyways, that would allow that unvaccinated employee with a disability to continue to work. And without getting too deeply into kind of the legal theories and doctrines, it really comes down to a question of whether an unvaccinated employee may pose a direct threat to themselves or to others in the workplace, largely by the prospect of potentially spreading a COVID infection in the workplace. If there is a direct threat of that, the employer is entitled to and is required really to engage in a reasonable accommodation analysis to try to work with the employee to see if whether that might be telework or might be other precautions, PPE, or other types of safeguards that can be put in place to either eliminate that direct threat or reduce it such that the employee can continue to work. But ultimately, even if there is no reasonable accommodation that is is possible and or wouldn't constitute an undue hardship, the employer would not necessarily be able to terminate that employee, but may be able to, not only may, but would be able to ensure and take steps so that that employee is not within the workplace and is not in a position to pose a threat either to him or herself or others.
And I think that, if I could just chime in, I think that distinction is very important to take stock of, because I think sometimes people, when they look at it, think they can jump right to termination. And it would be very tempting to skip that step, thinking not in the workplace means termination. So for those of you on the webinar, and you're getting people who might be getting sound bites on this, maybe like your managers and supervisors, and they're the ones dealing with their frontline workers. You just want to make sure that they don't rush the judgment in ways that might create that outcome, because that could put you at risk.
That's right, Mark. And this is kind of spelled out in a pretty good level of detail for folks in a recent federal EEOC guidance that came out on Wednesday, where the EEOC added to their existing pandemic-related guidance a section on vaccinations that deals with this specifically, and does go to pains to say that even if an accommodation can't be reached, that doesn't mean automatic termination. So I really encourage, we have another slide that references that later on, but encourage folks to, and it's in a question and answer format, this guidance, so it may be pretty accessible for employers, and I'd encourage those of you interested in that to read that. I do want to add a point about that, kind of revisit something I said earlier. While the EEOC guidance doesn't specifically say that employers may mandate vaccination, it certainly kind of assumes that they may. And you'll be able to see that by the way questions are posed by employers. And it's where these vaccinations are mandated that really some of these legal concepts like disability-related inquiries and reasonable accommodation come into play. The other exception, just relatively quickly, also creates the duty and burden for employers to accommodate, and that is for employees who will not be vaccinated due to sincerely held religious beliefs. And for those, in those situations, employers are obligated to attempt to find some accommodation for employees with these sincerely held religious beliefs, so that they can continue to work, but also not pose a risk to themselves or to others in the workplace due to their unvaccinated status. And what the EEOC guidance on this tells us is that employers should generally accept employees' assertions that they will not be vaccinated for religious reasons, even if the religions or those reasons are unfamiliar to them, but only if employers have some objective reasons to be skeptical of a religiously held reason not to be vaccinated can they ask for some further information or verification. So do tread carefully there in the event that you impose a vaccine mandate and you have employees or employees who decline to be vaccinated for religious reasons. So those disability related and religious reasons are probably the most notable exceptions to legally recognized exceptions to vaccine mandates. Okay, let's now kind of move into just some details quickly. If you mandate a vaccine, my view is that you need to pay employees for the time spent getting vaccinated, whether that's in the workplace, should you even be able to administer vaccines in the workplace, whether that's during the workday or employees travel off-site to be vaccinated. We think there are certainly under the FLSA a duty to pay. This is compensable time, and in many states also the expenses related to the vaccine, whether that be mileage or even the cost, those should be where, at least where the vaccines are mandated, those should be picked up by employers. Okay. We think that's relatively clear and is certainly a best practice, both from a legal and probably an employee morale point of view as well. So let's switch quickly to start talking about liability concerns, because that's very real, and I know something at the forefront of employers' collective minds. So what if there are side effects or reactions that employees experience due to having to take the vaccine because of an employer mandate? So as always, there are, liability concerns are real. They're very often incapable of some cut and dry answer. But if one assumes that the employer is following CDC and other guidance, FDA, and is doing all the things they need to do, some of which Mark has mentioned, to ensure that employees who, even if they must be vaccinated, are provided with the necessary information about the vaccine, and there's inquiries about whether there are medical reasons that would exempt them, exclude them from the vaccine, and so on. But you just don't know what possible liability there is. But following the prevailing CDC and FDA requirements is going to allow employers to say, we acted reasonably by taking all of the steps that were recommended to us. In other words, we based on the best information available, did we proceed? And for that reason, it's less likely that an employer is going to be considered to be negligent. Of course, if an employee suffers side effects or reactions that cause them to lose time from work, they may be entitled to workers' compensation or other paid leave, either by policy of the employer or as of January 1 here in Massachusetts, by state law, they'd be required to pay time off from work. So, but again, following the CDC guidance and FDA requirements and so on, in moving forward with this would be the way to go to reduce possible liability. Yep, moving on to the next slide. What if I don't mandate the vaccination, which is an issue? Is there potential liability for me as an employer? Again, I think that's pretty remote. Again, assuming that you may want to encourage vaccination, as we'll get to in a moment, and there are ways to do that as an employer that may be effective, but stop short of requiring it. But again, if you're following all the guidance and doing everything, you're taking the precautions that have been recommended to ensure a safe workplace, then chances are employers are not going to be held liable if they don't mandate vaccination, and as a result, an employee or another person is exposed in the workplace to COVID, and they're harmed as a result. Just a quick note, as you all may know, one of the bottlenecks in Washington to a new COVID stimulus or passage of bills is this issue about liability protections for employers who continue to operate during the COVID. So this is an issue. It may or may not have a fix down the road. It doesn't now. But again, if you're doing everything else that you can right and following guidance, there shouldn't be any liability if you do not mandate the vaccine. So again, what if I don't mandate the vaccine? What can I do to encourage it? Because obviously, encouraging it is a positive thing, not just in your own workplace and in your small part of the world, but in the country as a whole. Where, as a society, our goal is to try to get herd immunity, which may require 70 to 80% of the population to either have had it or have been vaccinated. So it is important, and it certainly probably would go a long way with your employees in terms of communicating that you value and care for their welfare and well-being, is to do things to encourage it, whether that's to inform, educate, provide opportunities, voluntary opportunities to be vaccinated, either at the workplace when that's even possible, or else somewhere down the road. You might want to incentivize employees in some fashion as well. You could probably do that through some financial or inducement or paid time off. So there are ways that employers can encourage and induce employees to be vaccinated, and it's something as an organization that employers should look to.
And I
And so
think also
just
incorporating a lot of proactive education too on the vaccines themselves and their level of effectiveness can also go a long way too, because you've got a lot of people who are concerned about the unknown. This is new territory for people, who maybe historically have always kind of withheld getting vaccines or flu vaccines or something like that, and they might harbor concerns about stories that they've heard. So I think arming yourself with the fact sheets and having some access at your fingertips about the effectiveness and what's been covered, and as that continues to unfold, is helpful. One of the things I will point out even on that too, that I kind of glossed over earlier, is one of the things that the FDA and the pharmaceutical companies are charged with, even as the vaccine is used during the EUA phase that I made mention of, is there's still responsibilities on the pharmaceutical companies to continue to monitor and update its guidance and update its studies and produce that to the FDA too. So that information that you're starting to see right now will continue to change as it continues to be utilized heading into 2021 and into the market at large. So,
yeah.
Even to the degree that that's being updated and strengthens the effectiveness arguments that are already out there, you want to be able to leverage that in your communication strategies as well.
Yeah.
Sorry, Tim.
Good point, Mark. As a trusted source of information, employers can play an important role in getting the right information and dispelling disinformation. So you're exactly right. Unionized employers, again, there may just be a few of you on today, but depending on what your collective bargaining agreement says, depending on what your management rights clause says, you may or may not be able to do it without a consultation with the union. But it may be a good idea, if you're considering that is a mandatory vaccination, to confer with the union about that, to determine whether, to what extent you can just proceed. So that's a pretty probably employer specific issue and will vary from labor contract to labor contract. Okay, I think I've just quickly touched on this. This is the EEOC COVID-19 guidance. Does seem to presume that vaccines can be mandated, but doesn't expressly say that. But some important information there, with links in this slide here to that EEOC guidance, which is going to be helpful in helping you navigate any of the disability related or religious type potential exceptions. So please do take a good look at that.
Yeah, and I just put in the source links, even with the wage and hour for people. I mean, we were talking about hours worked, and the reason why is, when we're talking about hours worked under the Fair Labor Standards Act, there are some different different situations which, while they're not actually doing their job as such under their job description, can still be viewed as hours worked. And the regulation here talks about medical attention that is really directed by an employer to that. So for those of you that might get pushback for your managers saying, well, why is this hours work? Why does this count towards overtime? Again, it's because when you start directing someone's time for their benefit, for your benefit as an employer, more often than not, it's going to be viewed as hours worked. And, like I said, to what Tim had alluded to too, with the union contract piece, the National Labor Relations Board does have responsibility, or companies who have to deal with the National Labor Relations Board do have responsibilities to bargain over mandatory subjects of bargaining. So how that shapes out is going to be a byproduct of your workplace and your contract too. So we wanted to consciously get through the material and provide ample opportunity to get your questions on the table for discussion. Allison, I know, has been monitoring the Q&A, and if there have been any put in elsewhere, Allison, if you could just unmute your line and put those questions on the table so we can get this conversation going, that would be great.
I am here, Mark, and there are several questions, so I will kick it off with this one. If you have employees that are in critical infrastructure in the organization, or essential in some ways outlined by the states, is there any queue or place you can kind of get them in the pipeline to receive the vaccination that you're aware of?
Not at this point in time that I'm aware of. I mean, one of the issues is going to be accessibility. So, to that end right now, one of the things to understand is right now, a lot of the vaccines are going to the hospitals themselves. I mean, they're the ones with the equipment, the functionality, the refrigerators or freezers for storing it. For instance, Pfizer requires special equipment to keep that on ice. Moderna's is not so much, so to speak. So the question really is going to be, how are they going to funnel it to others that have committed to wanting to make the vaccine available when it goes more streamlined, like your area pharmacies, who many of which have kind of gone on the record manifesting a request to want to do that. That's still being worked out based on some of the distribution logistics challenges. So as a result of that, as far as a queue is concerned, it's kind of hard to really kind of set all that up where you don't really know where you're directing people to. All I know is right now, the availability is going to be with the hospitals themselves, and to that end, it would seem to me that the hospitals are going to have to validate out people for purposes of knowing if they're allowed to be able to take advantage of the vaccine. But I would imagine more details are going to come out as it becomes more widely available.
Okay, thanks, Mark. The next question happens to come from a healthcare organization, but I think it could translate to others as well. They don't currently mandate vaccinations for current employees and aren't sure they're going to mandate the COVID vaccine. But if they don't do that, could they still elect to require new applicants or new employees to the organization proof of vaccine?
But let me take a crack at that one. The short answer is yes. I mean, again, because we think employers may lawfully mandate, if they want to mandate the vaccine for a subset of employees, in this case, new employees, I think they're legally able to do that, subject again to the various exceptions, disability related, religious, or possibly union related. So yes, I think an employer could choose to do that very thing.
Yeah, and I kind of come back to the idea that because the EOC also has indicated it's not a medical exam per se, that gives more latitude, I think, along those lines. I just think the only thing's going to be is if they are going to produce documentation to validate that when they're being hired, The company just has to be mindful of anything that might be on that document that might identify someone's other medical condition otherwise that might
Yeah.
create some sort of issues with the Genetic
Yeah.
Information Nationalization Act or what have you, because then you've got to make sure you're
Yeah.
keeping that protected and not putting that out there to other people in management who don't even need to know.
Yeah.
All right, let's stay a little bit on that topic. We've got a question about the religious and disability exemptions. And there's a question about what documentation can an employer request
Mhm.
based on those?
Okay, I'll take the first stab at that, Mark. So an employer is entitled to sufficient medical documentation in the disability related situation in order to determine whether there is a disability and or the contours of the need for accommodation. So it wouldn't be really very much different than the way things are now, unrelated to COVID-19 or to vaccination. So employers are not required just to take an employee's word for it. They are entitled to get some, I don't want to say basic, but I'm going to say it, medical information in order to verify whether there's a disability and a need for reasonable accommodation. In the religious context, as I said before, if an employer has an objective reason, and the EOC guidance seems to suggest just having never heard of a certain religion or a certain religious belief or principle, if they have an objective reason to I'm going to say doubt a religiously held belief as a reason not to be vaccinated, they can seek some type of verification, whether that is a letter from a pastor or any variety of things it could be. The guidance, unfortunately, doesn't go into detail. It doesn't give employers much guidance on what proof, if any, they can require, but that's what the guidance tells us. So employers do have some options there, but may not be able to get as much information as they would prefer.
Yeah, and it gets to be a little bit of a slippery slope there too, in the sense that when we're talking about the accommodations, it's not necessarily what I would call your traditional or mainstream religions either. When you're talking about religious beliefs, that can be, some religions can be construed fairly broadly. Also, especially at the state level too, by the way, too, when you're talking about beliefs, so
Yeah.
it is not as demanding of a standard as it might be otherwise, but you again, having some objective background that formulates the reasonable basis for why you're questioning their position, I think is going to be important in that regard.
All right, and we have a question, back in conjunction with the ADA. So when Tim was referencing, the intersection of this with ADA, if you're an employer and you can't make an accommodation without undue hardship to the employer, I think it was discussed that you really watch the separation that you have from that employee. But if you truly can't make the accommodation, are there options beyond leaves of absence and things like that either of you would recommend?
Well, the one that comes to mind is telework, but obviously that's not always practical or possible for employers. But one of the things, the guidance, that's the thing that most quickly comes to my mind, Allison. One of the things that the EEOC guidance says here, its most recent iteration, is that employers should consult with the job accommodation network. I'm not sure that is an organization that serves to find reasonable accommodations and to communicate and educate and inform. So again, employer might be well served if no accommodation, if a leave doesn't work and telework doesn't work, you may want to explore that. But it doesn't say that an employer could not terminate employee, but what it does stress is that just because one shouldn't rush to termination as the automatic outcome of the inability to accommodate an employee's disability related reason not to be vaccinated.
I think the only other thing I would also throw out there too is, when the guidance also talks about that they're not available for work, that you don't have to keep them in the workplace. You can take them out of the workplace or not allow them in the workplace. That also introduces a different question of whether a temporary unpaid leave of absence could be an accommodation in and of itself. So, you still have to kind of go through the interactive process of evaluating how long of an unpaid leave, you can afford to do. We don't know how long this pandemic's really going to run and when things might loosen up, so to that end, that might be also something else to take stock of when you're reevaluating your options. Or maybe it is transferring to a vacant position that might allow them to telework more easily, where the job that they might have been considering or that they're in might be more limited in that regard too, perhaps itself.
Okay, thank you both for that. And we've got some additional questions. I just want to let folks know there's been several requests in the chat and the Q&A about going back to specific slides. I just want to remind everyone that we will be sending out the slides along with a copy of this recorded presentation along with the Q&A. So we're not going to be able to bounce back to certain slides now, but rest assured you will get these slides and the recorded session. So I just want to continue with some of the questions that we have. One of them is if, we talked about paying the employee if they get vaccinated on work time. If they choose to get a vaccination outside of work time, is the employer still required to pay them for that because the employer is mandating the vaccination?
All right, so that question sounds to me like we mandate vaccinations, but we have figured out a way to administer them at work during the scheduled workday, but the employee chooses not to take advantage of that and prefers to go get that vaccination elsewhere for whatever reason. Do we still have to pay? I would encourage you to, yes, do that. Let me tell you why, because, depending on what the employee's reason for not doing that, maybe if their reason is the kind of thing that, oh, wait, I don't want to answer the employer's asking the pre-screening questions, which may prompt me in order to answer those. I have to talk about either a disability or a potential disability, or I have to talk about a family history, which could reveal protected, genetic information. So their desire to decline to provide that information to their employer and therefore have that information, recorded and stored at the workplace, might be legitimate. Again, that's assuming that was the reason. So you might want to still pay for that and respect the fact that employee is doing it elsewhere. But as a strict matter, if you're providing it and the employee just doesn't want to do it, wants to do it on their own, then you may not then have to do it. But I still think it might be a best practice.
Yeah, and I agree with Tim on that too. I think the more stringent you impose as far as not only what they do, but how they do it, the more you're really putting it in that hours workspace, the more that they exercise freedom to do it outside of your channels, then I think that does open up a little bit of latitude. But again, it's probably best served to, cover it the way that Tim described. I would agree with that.
Okay, I do want to point out, we know we're at the 1:30, the bottom of the 1:30 hour here. So we are going to keep answering a few questions. There's
Sure.
several questions left. There's not enough questions that will take us to happy hour here in the Northeast. Probably a few more minutes, I would say 15 more minutes or so, just for folks who may have other things going on this afternoon. But again, we are recording this and we'll record it to its conclusion. So if you can't stay with us, don't worry about it. Next question, a couple of folks have asked, they're multi-state operations. So they're concerned about how they get information about vaccination opportunities in other states. Are either one of you aware of any sort of central database that might be available to employers to get this information?
I am not aware of one, and if there is going to be one, chances are it would be with the CDC. I think what you're going to have to deal with is your local state Department of Public Health officials, because they're going to be the ones driving, the distribution and vaccination plans. And again, every state's a little bit different like that. So unfortunately, I don't have a straight answer on that right now. I think what is encouraging, and again, I use Rhode Island's as an example, theirs is still in draft form and it hasn't even been finalized as of yet. So that could be even subjected to change. But the fact that the CDC is collecting the plans among the states, I think gives some hope that it might then be centralized and made available as that gets flushed out and finalized. So I think if it's going to be anywhere, it'll be there. And I would encourage people to continue to check the CDC periodically.
All right, we've got someone who's wondering your thoughts about sending out an employee survey, kind of, no pun intended, taking the temperature of the employee group, right? To see who might be open to getting a vaccine, who is greatly opposed to getting a vaccine, just to get a pulse and a sense of, obviously in an organization where maybe you're not considering mandating it, but just to kind of take the pulse of the organization.
I'll jump in quick here, Mark. Well, I guess only with the concern that depending on how the survey goes, the questions, what you don't want to be doing unless you really want to be doing it, and then there's all sorts of gets complicated, is asking people questions that are going to prompt them, not because you've asked it, but are just going to prompt them to reveal things like, disability issues or that they may have, or family history, or religious beliefs. If you just take yes or no for an answer, would you take a vaccine? Do you want to get a vaccine? And tell people, assure them that they don't have to provide any more information. You don't need to know why they feel that way. Then it's probably okay. But don't inadvertently get into where it seems like you're fishing for, protected health information or disability related info.
Yeah, I mean, keep it more like a straw poll, make the responses anonymous. If they're going to want to characterize in terms of just gauging whether or not the company might want to try expediting ways of putting on an event down the road to the degree it's more mainstream for the benefit of employees, and would that be of interest to you, yes or no?
Yeah.
To try to put a positive, constructive spin on why you're doing the survey. Yeah, but I would keep the questions yes or no based, and I would frankly make it anonymous. I wouldn't even have people putting their names down on it. Because the other thing you just don't want to have is companies then trying to, even though you can require the vaccine to be done, you want to do that systematically. You don't want to be, I think, arbitrarily doing one-on-one follow-ups in ways that could be coercive towards a certain plan of attack one way or the other. Maybe because that person might have pre-existing conditions or family history issues, and have someone feel like they're being singled out because of their background. So I would just, I could see the potential, like Tim was saying, that something could come of that initiative if you got into people being identified or having specifics put on the table through that questionnaire process.
All right, and kind of a follow-up to that, if you are mandating the vaccine and someone refuses it, is there a procedure or a way that you should be documenting this that you would suggest?
Well, again, assuming that if their refusal is unrelated to a disability or sincerely held religious belief, just I don't trust it, I don't want it, I don't believe in it. How do you document that? Well, in writing, obviously, you'd want to make sure you do it so that it's not unclear. You might want to give, again, people a second chance. You wouldn't want to necessarily fire somebody just based on an initial refusal. You might want to, again, take that, try to induce, inform, educate. Again, because it's obviously aside from the optics, the reality of firing people for this and possibly having legal liability related to it, or at least have to defend legal claims, is something you want to avoid. Obviously, understanding that, if you have a policy like mandated vaccines, you need to enforce it too. But again, just documenting it, giving maybe a second chance before somebody loses a job over it, is probably the way to go.
All right, we have a question about the vaccine distribution. Do we know how that's being handled? Is it being handled through the local boards of health? I know we've seen that CVS, Walgreens, I think Big Y, regionally here, they've all put out, statements that they're going to be providers of vaccines. But do we know the official channel of distribution for these?
That's, to the best of our knowledge right now, it is through the state departments of public health, who are the ones that are engaging in purchasing the vaccines. I think Massachusetts initially had like an order of like 60,000 vaccines for Pfizer that was going to be for the initial amount, I think, for the first few months. And I think it's then going to be the state then working with the hospitals and other groups that want to be a part of that effort. So my sense would be is if that's any indication of how other states are going to operate, and again, every state has the wherewithal of doing a little bit differently, I suppose, that's going to be a byproduct of their COVID-19 distribution plans that they've submitted to CDC and what they want to do with those other private organizations. But it's going to go to the states, and then from there funnel out to private entities, more or less, is the short answer.
All right, and another part of that question that relates to it is, who's on tap to produce the list of essential workers as these phases roll out? Do we have any information on, how they're designating? We're seeing the states are designating, kind of similar categories of essential workers, direct healthcare workers, police, fire, AMBO. How do we have any information on the communities producing that list of essential workers, or how that will flow?
Well, I mean, the essential worker the characterizations as noted in their COVID-19 vaccine distribution plans, unfortunately, that's going to be more at the state level. How they interpret those classifications from a guidance and regulatory perspective, that private employers and frankly even city and town officials, because when you think of first responders, a lot of that's going to be in the public sector. How is that going to be validated? It has not been flushed out as of yet.
Okay. This is our final question. It's kind of a big one, and I think that everybody who's on the line can relate to this and is concerned about this in some way. You're an employer that decides not to mandate the vaccination. Employees talk. We know this, right? So some are going to say, hey, yes, I went and got vaccinated. And others are going to say, hey, there's no way, I'm not doing that. I'm in the camp of, I'm an anti-vaxxer. And how do you handle that? Because some folks may not want to report to work. They're going to say, hey, Bob in accounting didn't get his vaccine, or I'm not going to go to work with a bunch of my coworkers who decided to opt out of the vaccine.
That's a great question. Even after not after the vaccines, I mean, a lot of public health experts think, this, just getting a vaccine or not isn't going to dispense with the need probably all through 2021 for everyone to remain masked, to be following the very, hygiene and other precautions, hand washing and temperature taking. One of the things that may be happening really quickly too, that there not been less attention to, is just the maybe greater availability of rapid, more reliable tests, whether for home use or maybe employers are going to stock up on those. So again, great question, but I don't think that, just because somebody chooses not to be vaccinated, assuming there's not a mandatory policy, that's not going to justify or entitle employees to stay home from work. It's kind of like, what we were dealing with in the spring, where there was just a lot of concern, sometimes well-founded, sometimes a little hysterical, about not wanting to be exposed. So the more people that get vaccinated, and we continue maybe to have rapid testing and better contract tracing, will hopefully, mollify some of these employee concerns. But the vaccines aren't going to, be the cure all that we hope they would be.
Yeah, and if I can just amplify a little bit, because, even with the availability of the vaccines, I mean, you're still dealing with state requirements and they're all different when it comes to reopening guidelines and companies having to have COVID plans for managing the exposure and risk of that. And the vaccines are not going to be a panacea to relieve companies of following through on those plans outright. And to that, I think you have to use those plans and the measures that you use or that you've employed in an educational and in a positive way to communicate to those people that are still apprehensive, just like, frankly, some companies have been wrestling with now up to this point. It's a way of getting them back into the workplace because of the job requirements that need to get done for companies. That'd be number one. I think the second thing, too, is some other piece, and that is, should they do come back into the workplace because you've educated them, you've cajoled them, you've otherwise have gotten them in because they know they can be held accountable if they don't. To Tim's point, I think the other thing that management has to be cognizant of is making sure that those people don't retaliate against the people who are not getting vaccinated due to exception grounds that Tim made mention of earlier. You don't want to be having those people arguably try to foster some Title VII or ADA claim because they've been accommodated by management, but you don't want to have, by the very same token, management not on their game, making sure that those people are not targeted by coworkers in a way that could be viewed as retaliatory. So, like anybody else who exercises their rights under federal or state law, it's always incumbent on management to make sure that their rights are not being trampled by coworkers.
Yeah, that's great advice. And I think, we're kind of back to March in some respects, right? Where we don't have all the answers right now, but we're forging the path, and we're going to have to make tweaks and changes to our policies and our plans as we move forward here. One final question before we close out. Since the vaccines are now only in emergency use authorization status, does this prevent an employer from trying to mandate the vaccinations?
No, in my opinion.
I would agree. If you look at the timing and the context of the questions that the EEOC published in their guidance, it's out there on the pretense that they could be those questions, those issues govern the current situation, which would be the EUA use of the vaccines.
Just a final thought, can doesn't always mean should, as I've indicated. And so my advice is that employers shouldn't do it right now, but they could if they choose to.
All right, I'll turn it back over to you, Mark. That's it for the questions.
Allison, thank you so much. I know we kind of went over on our time, but again, these are all valid, compelling questions. And that's why we wanted to put this program on now, because it's a lot to digest. It's a lot to report back to your senior leadership teams on, to evaluate the pros and the cons and the paths that you may choose to take based on your operating needs and your culture, frankly, for that matter, as to, what makes the most sense. And if it is to go down the path of really trying to work those vaccinations into your operating principles, do it in a way that's going to be as constructive, as positive as possible. And that's going to mean really plan for that to happen when it becomes available for your particular business. Certainly, again, some of you are going to have to deal with it sooner rather than later. But for others that are not going to be able to hit it head on until months down the line, as we get into hopefully the warmer season of 2021, continue to, check in with us, check in with Skoler Abbott, because undoubtedly this will not be the last time this topic will be broached as more guidance is forthcoming on it. So stay tuned for more. Tim, once again, thank you very much for partnering with us once again. I think a lot of great perspective and feedback. And I hope everyone on the line did enjoy it today. And if we don't speak with you otherwise, I hope you all have a wonderful holiday season.
Thank you.
Take care, everybody.